first place, I want to thank God Almighty and the Federal Ministry of Health, in collaboration with our donors, the United Nations, the UN groups, and other donors that have been supporting Nigeria in the HIV program to make sure we get to the zero epidemic. Now, this meeting become a very crucial one because we have made a lot of advances in controlling this epidemic among the adults. Like you say, for the children don't have anybody to speak to them, and that is why this is a paradigm shift to focus more on the children. So this meeting is about ending HIV among the children and the adolescents and pediatrics. So now what we are trying to do is to create more awareness among the public that the children should not be left out in the fight against HIV pandemic in the nation. What we want the federal government of Nigeria through the Federal Ministry of Health to do is to show more commitment in terms of funding. Most of these programs have been partner-driven, donors-driven, and as we can know worldwide, due to global economic indices, the funding is allocated is dwindling. So the Nigerian government, through the Federal Ministry of Health, need to show more commitment in terms of release of funds to finance most of the program that is highlighted to achieve what this our meeting is set up for.
Yeah. Thank you very much. What is ongoing at the moment is having a national consultation on pediatrics. If you take note that for the last 30 odd years that we have been working on HIV, we have had significant advances in the management of adults that have HIV. Unfortunately, the management of children has lagged behind, and the coverage is not as good as it should be. So, and based on this, that it's not only even peculiar to Nigeria, although Nigeria carries one of the larger burdens of the missing children that we haven't found globally. So based on this, there's an alliance of 12 countries to see how we can identify the children and how to put them on treatment. And as we know that we consist of 36 states and FCT, and it's at the state level we're going to need to look for the children. This is a consultation bringing out the state actors from the states, working with partners, government partners and other development partners to see how we can see what the challenges are, what the issues are, and how we need to respond to make sure that we can catch up the response for children as adults. As you're aware, our children can be left behind. They are the next generation that we need to look out for and to manage them effectively.
Okay, my major.
There's so many ways that children get infected. We know that a good proportion of them get infected from mother-to-child transmission of HIV. And what we have a PMTC program, Prevention of Mother-to-Child Transmission of HIV. So one of the major things we try is to try and what we say we close the tap, that children don't get infected at all. So we've been looking at issues surrounding our PMTCT program, a Prevention of Mother-to-Child Transmission program, to ensure that every single pregnant woman should have an HIV test, because the only way we can manage them is when they know their status. After they have the HIV test, then we can give them the appropriate, because if you're taking the right medication, the chances of you having an HIV, of you transmitting HIV to the child is very, very slim. Apart from the other cases that children can get infection also. You can have some through blood transfusion, through needle stick and all that. So those are the other cases we're trying to manage. One of the challenges we have is that the prevalence in children is 0.2%. It's very small. So it's like trying to look for a little needle in a haystack. So we have to look for how do we really identify the children. And the earlier we start treatment, the more likely the child may be able to do better when the immune status is still. So what we're trying to do is to see how do we really identify the children, and one of the easiest ways to identify them is to test either the parents or the siblings that have the virus. We have a higher yield than that. The way a lot of children present, because they present, some of them you see that they're not doing well, as we call it, failure to thrive. As a baby progresses in life, there's some milestones the baby should be having. Those milestones might not be maintained. You can see that the baby is wasted. When the baby is wasted, it's lost so much weight. The baby might have diarrhea and all that. They can also have a lot of skin rashes. So those are the issues that you can find among children.
HIV infection, as you do know, is an infection that can affect children and can be transmitted to children as well. And the sad thing is that it is an infection that can be acquired by children through their parents. It's one of those infections that are considered as congenital. That is, a child can acquire HIV infection through their parents from pregnancy, at the point of delivery, and shortly after delivery, especially the period of breastfeeding. So, and it's a sad situation that we found ourselves whereby an individual being born is already being born with HIV infection. You can see the sad story. And HIV infection, especially in children, is one that progresses very rapidly. Once a child is born with HIV infection, there is a tendency, if it is not recognized early enough and interventions instituted by way of treatment, for that child to quickly develop HIV infection and it spreads. And before the advent of antiretroviral therapy, many children that were born with HIV infection, they suffer a lot of disease in the first 2 years of life, and up to 60% of them may not survive beyond that first 2 years of life. So it's very, very important to have a program like we have now, whereby efforts are being made to identify women, pregnant women amongst the general populace who may have HIV infection, and place them on treatment so as to prevent transmission of HIV to their unborn babies, and continue with their treatment as well as care and treatment also of the newborn infants throughout their childhood. That is why this program was established by the Federal Ministry of Health to address these particular disease entities. There are many diseases, as we do know, in Nigeria, and our belief is that every disease should be having similar priority. But you know, the impact of HIV, hepatitis, and STDs is such that it goes beyond just people who are adults and are aware of what they are doing, but these are diseases that can be transmitted to innocent children who are yet to be born. And without such a program that is purposely packaged to address the issues of transmission to children, infants and children, you have that tendency of the disease spreading amongst the population as well as the general public. And you know, for HIV infection, there's largely no cure as such. So what is the effort there is to see what can be done to prevent it from happening. But once it happens and we're able to identify children, we are grateful that now there is treatment that we are trying to get as many individuals infected, not just children, as possible to place on treatment. And that has been the vigorous effort of the National AIDS, STI and Hepatitis and Control Program, to be able to identify those people who are probably infected. They are out there in the community, they are not aware that they are infected even, because these are diseases, again, that can be acquired and the person remains infected, but they are not yet manifesting symptoms. And unless you make effort to identify them that early before they begin to manifest symptoms, that is the best way to actually put them on treatment without the disease showing in their systems. And once that begins to happen, that's where you begin to have problems. And even with treatment, the success may not be so significant. So it's important to identify people who are infected but not yet having disease or symptoms. The outcome is far better when you begin to treat people at that stage. But once an individual begins to develop symptoms, like in HIV infection, once there are stages of the disease, the earlier stage is when they don't show symptoms. They may not even know. And the advanced stage is when they show wasting, they have tuberculosis, they have so many other disease conditions that are overt, visible. So at that stage, when you begin treatment, the outcome is not so good. But many can still get treated somehow and live with the disease. But they don't have symptoms that will disturb their normal lives.
Thank you very much.
Well, before I start, I think we need to correct something. Not really, of course, STIs and the rest we're talking about are there, but the main discussions are around HIV. Yeah, HIV, STIs, and STIs. So I think I will need to correct that first. So you're talking about the impact on, yeah, the theme, I think, explains it all, which is ending, especially pediatrics, HIV by 2030. So I think the pediatric, the adolescents fall under youth and above. So if that is prevented at that level, then of course that is a very big positive to the country, to Nigeria, with respect to youth. It turns around and the outcome is numerous, socially, economically. When you have a healthy youth, you have a healthy nation, a wealthy nation. So I think keep on talking about the impact, the positive impact with respect to this country.
Okay, as a stakeholder,
I think for me, my understanding, the number one advice is to implement documents. We have documents that are being processed, and we need to implement those documents. Sometimes they lie fallow. After developing documents, we have clean, very good and robust documents that have been developed, and we need to implement that. I think part of the problems we encounter is having documents to lie fallow, leading to an estimated time of eradication of whatever will now spill, and then there will now be a retreat to now expand that. So I think the number one issue is to really implement the document. And implementation of that document, of course, has to do with financing and stuff like that. So I think whatever measures will be taken to make sure those documents that are developed are implemented, I think that's the very best advice I would give.
thank you very much.
We're actually facing the issues of pediatrics coming out to get them tested, and we have large numbers of pediatrics and adolescents out there that still doesn't know their status, and you know, with the country and the situation, we need to bring them to care. There is care. The government have provided care, and we need them to come out in large numbers too. So this is us trying to look into strategies, barriers, and how we could improve health generally based on HIV response. And it's been an amazing journey trying to rack our brain. Okay, where are we missing out? Where are we not doing well? Trying to scale up a lot of things, and trust me, it's going to do the country a huge favor, because if we don't know where the problem is, we don't know where to solve the problem. So that is what we are doing. Challenges has always been people being scared. I think the earlier stage of people knowing about HIV, people still need to reorientate themselves that HIV has gone beyond our problem. HIV is not the problem again. Poverty is the problem in Nigeria. Let's forget HIV. HIV is just a minor thing, and it's not that big thing. So I think people need to keep updating themselves about what HIV really is, and people should also care about their self. Go out, test yourself, know your status. And it has been so easy. It's not like when you go to the facility and say you want to test. Like I am saying, I'm from Niger, youthful, alive, and healthy. You are youthful, you are alive, and you are healthy means you get tested, you know your status, you know how to control yourself. We have prevention, we have post-exposure prophylaxis, we have pre-exposure prophylaxis there for you. So what else? Just get out, test yourself, and you can even test yourself inside yourself. You have your privacy, which is the self-test kits that we are actually. So it has improved. People just need to come out and test, and that's been the major problem. People not knowing the knowledge of, okay, this and this is right, this is wrong. Majority of our men and women, please come out. Youth, you're in the high risk stage, and you're not coming out to test yourself. It should be every 3 months. Check your HIV status, know your status, know where you belong. Don't just kill yourself. There is a saying I used to say that it is you knowing what is doing you that you know where to apply the balm. If you don't know the problem, you don't know the solution. So when you know the problem, you know the solution to do to it. Thank you.
Thank you very much.
Take in pediatric ART, I think that's what you really meant, is our government should take ownership. It's been a long period where IPs, donors, sponsor the ARV, the treatment of HIV in Nigeria. We want Nigerian government to take ownership. We want these children to have quality access to treatments. We see scenarios where these children ARVs before now were changed several times in a year. We want to see where their drugs will be readily available, accessible at every level to the rural community. We want to see where they can get quality access to treatment, because we see scenarios where children are faced with depression and stress of pill burden, taking of these drugs. We want to see how these drugs can actually be reduced, the pill burden can be reduced, where these drugs can be accessed easily, where they can get quality care and treatment. We see children come up with opportunistic infections. There are no forms of testing or treatment for these children. And we see scenarios where some of the parents cannot actually afford for treatment for these children. We actually know that some of our rural communities, caregivers do not actually have this capacity to provide for the care and treatment for these children. So we want to see our government meaningfully supporting the treatment for children. And even when it comes to TB, I don't know if there's a specific test that is run for the testing of children that have TB. We want to see our government meaningfully getting themselves involved in HIV treatments, TB treatments, opportunistic treatments, opportunistic infection treatments for children and adolescents.
Now, let's look at the app.
Yes, I think the children is a major concern now, because a lot of them are going down. Statistically, for the last couple years, they lost over 100 children because they were not doing well on their treatments, which a lot of things might be the factor that resulted to their deaths.
So what your
statement to Nigerian government, Federal Ministry of Health is they should take ownership of the ART treatment for adolescents, pediatrics, ART in total. They should take ownership. They should take the bull by the horn. It's high time we stop depending on donors. You and I know that donors are actually, their funds are dwindling, and most of them are going back to their countries. Our government should take ownership, and let's see how the treatment center can actually do better.
Thank you very much.
Thank you for watching BMC TV. Please watch, like, and subscribe to our YouTube channel.